Hello and welcome to today's webinar, Steering Members to High-Performing Providers to Reduce Cost of Care. Before we get started, I'd like to review a few housekeeping details. Today's webinar is being recorded, and an online archive of today's event will be available within 1 to 2 business days. If you have trouble seeing the slides at any time during the presentation, please press F5 to refresh your screen on a PC or Command R if you're using a Mac. And you may ask a question at any time during the presentation by typing your question into the Q&A box located on the right side of your screen and pressing Enter. And finally, I'd like to remind you of AHIP's antitrust statement located in the link just below the slide viewer. As always, we will comply with that statement. Among other things, the antitrust statement prohibits us from discussing sensitive information. And at this time, I would like to turn the floor over to Tiffany Kahn, Director of Product Management at HiLabs.
Hi everyone, my name is Tiffany Kahn and thank you for the introduction, Joanne. I'll be your moderator today. And so before we get into this webinar discussion, I want to give a brief overview of the overall webinar itself. So today we'll be discussing in the ever-evolving regulatory landscape, a lot of health plans face immense pressure across optimizing provider networks, increasing market share, reducing medical costs all the time, especially in this year where there's a lot of higher than forecasted MLRs. And so ultimately, these improvements in general are hampered by a lot of traditional network management approaches, whether they're outdated or fragmented data silos. There's a lot of it resulting in a lot of inefficiencies, high administrative costs, as well as missed opportunities to ultimately improve care. And so what you'll see in this session today is that we have industry leaders. We have the CEO of HiLabs, Amit Garg, as well as Carl Byers, who is the partner at F Prime Capital and as well as the former CFO of athenahealth. They'll be really exploring how real-time AI-powered solutions can really redefine what network management what network management can do across multiple different pillars of network design, steerage, retention, as well as referral management, and which typically, when it comes to traditional network management, stops with compliance. And what is AI's true role in this in terms of improving access to high-performing providers, reducing leakage, and in turn, ultimately improving the member-patient experience while reducing cost of care. So that's what today's webinar will be about. And so I want to first of all introduce our speakers. So we have Amit Garg. He is the CEO as well as the co-founder of HiLabs, and he really brings truly an extensive experience across business development, product development, operations, consulting, as well as financial analysis, and as well as he has successfully led 2 startups from an inception to acquisition, really demonstrating his overall expertise in scaling and strategic growth. And right now, he's currently, obviously, the CEO of HiLabs, really focused on providing payers as well as providers and patients with access to clean and timely and actionable data across the board. And next of our speakers is Carl Byers. He is currently the partner at F Prime Capital and as well as the former CFO of athenahealth. He's also on the board of HiLabs, but he ultimately brings a significant operating experience in healthcare IT as his role as partner at F Prime Capital. He is also was on the founding team at athenahealth, and where he served as the CFO from 1997 to 2010, and as well as played a very key role in leading athenahealth's 2007 IPO. And since then, he's been also a lecturer at Harvard's School of Public Health, and as well as a previous member of the Massachusetts Digital Health Council. So I'm welcoming both of them, and I'll transition to Carl to really walk us through what has he seen in the overall provider space when it comes to the challenges and pressures related to specifically the compromised care journey for patients and providers overall.
Well, thank you for the introduction, Tiffany, and it's great to be here with all of you. This is a really important, timely subject for health plans and for really all participants in the healthcare ecosystem. And that's because healthcare is moving from a relatively slow pace to a real-time data-driven pace. One of the biggest changes for providers in my career was shifting from paper to software, and then from software to data, and then from data to automation, much of which is powered by AI. And I think that what's going on with insurance plans is the mirror image of that. as patients now receive medical test results within 24 hours, their providers are often caught on their heels because they haven't received that report yet or had time to look at it. Similarly, health plans may have really no idea what's going on with the patients because of the cycle times. And so I think what we're moving toward is a real-time data healthcare system that requires every participant in the healthcare system to modernize and invest in infrastructure that allows them to play in a real-time data world. That's where I think HiLabs plays a very important role in helping payers to modernize. And then I'll just touch on the fact that I looked at a lot of this from the provider perspective for years at athenahealth. At Athena, as I mentioned, we helped move people from paper to electronic and data-driven solutions. Athena now serves over 150,000 providers. It's doing over 5 billion transactions a month. And I believe over 700 million patient messages a year. And so this is sort of the modern world we're living in, where people need access in real time to what's going on. And that requires us all to upgrade our infrastructure. I was at Athena, as mentioned, from 1997 at its founding through 2012. I led our IPO, until 2010. I led our IPO in 2007. And the origins of Athena Health were actually inside the medical office. We owned and operated medical group for the first 2 years of our existence. The software platform we created was actually an in-house tool we built to help us get control of the operations. So in those early days, we had a lot of sympathy for the life of providers because we were a provider, and we understood the challenges of trying to deal with the various requirements of many different health plans. All of those requirements exist for good reasons, but for providers, they often are overwhelmed by the complexity. And I think now we're in a world where it's not just the revenue cycle they need to worry about, but also strategically, which plans am I in? What prices am I accepting? And where am I going to appear in network as a high value provider for health plans? And so really improving and modernizing the way provider data is managed is a huge win-win for both providers and payers, because payers will know better where to steer members to get the best quality care at a good value, and providers will know how to align their infrastructure so that they can receive patient volume and get paid appropriately for the care they're delivering. So I think these themes, sort of to summarize so we can then move into other themes and questions, have to do with the modernization of our healthcare system and the providers and the payers working as two sides of the same coin in that regard, where each entity can understand better the status of a claim or a request for prior authorization, or to know, even if you're in the network, that allows everybody to coordinate better on behalf of the sponsors of health plans and the members of those health plans.
Great. And so thank you so much, Carl. And I want really Amit to sort of highlight what are some of the issues that you've seen on the payer side as well, so we can give, equal amounts of discussion points. But Carl has given the provider side, and I really want you to kind of go into the payer side as well.
Thank you, Tiffany. So first of all, thanks for having me. And it's an honor to share this panel with Garg, who is not only investor and part of our board, but also he has been a great mentor for HiLabs and for me personally. So pairs, so before that, I'll quickly introduce HiLabs, what exactly we do. Our focus is on solving what we call the dirty data problem in healthcare. And some folks asked me that, okay, so what? Like cleansing dirty data, how and what it can help for healthcare organizations. Right? So we focus on cleaning healthcare data, especially when that impacts the payer's business. And for example, payers, as many of us know that they are struggling with their forecasted MLRs. Right? Many of the payers are experiencing higher than forecasted MLRs, and one of the key initiatives towards containing cost while improving the quality of care is having high performing network. Right? So what are the challenges that payers face in creating, maintaining high quality network? So I'm going to talk about those challenges first. Number one is how network building must start with accurate, complete, and timely data. As Carl mentioned, the timely part is equally important as the quality of data. And what we have focused on, beyond just cleansing data, that how do we enable the payer provider communication in terms of data exchange. How can we leverage technology to ingest data from providers without putting burden on the providers to change their systems, create customized data templates for each pair. And today AI, and we'll talk more about that later in the discussion. Today we have the right tools, the technology to not put that burden on the providers and enable smooth payer-provider data exchange. Now, going back to the challenges that the payers face in terms of optimized network, number one is, as I mentioned, data needs to be timely, but then the data needs to be accurate as well, right? So the first issue that they face is having deficient geo access inadequacy. What that means is, so we did a study that was peer reviewed and published in the Journal of American Medical Association. And in that study, we found that 81% of the times, the physician's information in their directory was inconsistent across the top 5 health plans in the country. Right? So imagine with that kind of inaccurate data, the kind of deficiency the members face when they are when they are trying to access care. And so that's number one. Number two, if payers, because of the lack of clean data, payers might not have a full understanding of high quality providers in their network, and what that can lead to members, more members going into high quality providers, and that can lead to overburden of healthcare delivery for the providers, and that can lead to provider aberration. That's point number two. Then, in case when members might not have access to in-network high-quality providers, they might opt for out-of-network, and that can lead to high out-of-the-pocket spend by the member, and that leads to very high member aberration. Right? And then, if payers do not have their arms around the right set of providers in terms of quality, and if that leads to getting rid of low quality providers and not having the right understanding of their data, that can also lead to their RFP risks, especially when it comes to employer-based insurance, and then also can also lead to provider litigation. Right? So overall, across all of these challenges, the foundation has to be clean and timely data access for peers.
Great. And so I think the people who are on the line, we've heard about the provider problem, and we've also heard about the payer problem. To summarize, a lot of this data ends up the solution is how can we get real-time data as well as clean data, accurate data to really avoid all of these different scenarios from occurring. And so what we have found the solution to be is what Amit and as well as Carl will be going into here in terms of where can AI really play in this space, as well as interoperability can play into this space. So Amit, I'll give it to you to discuss first.
Yeah, so I think as Carl mentioned, peers have access to a lot more data than providers, especially when it comes to data across providers for a member, and not just claims data. Now, a lot of payers are focusing on acquiring EMR data as well from providers. Then obviously they have access to member data, and then payers are also putting a lot of effort in looking at the market data. And when I say market data, there are things like price transparency data. And again, there are challenges around analyzing price transparency data, but with access to all of these data sets and access to technology that can very much like reason like humans, right? So a lot of these large language models and generative AI, along with the agentic AI, this is an opportunity where technology can mine massive amount of data of different types. And then with access to clean data, there's an opportunity for payers to design their network that they could have never done before. And that could be based on their member profile, right? So if in a certain geography, a payer has certain type of demographics or certain type of disease profile, now there's an opportunity for them to design high quality provider network, which is very much customized towards their member cohort. So that's an opportunity in terms of designing high quality network. Now, the second thing is about network steerage. Now, with high quality provider, and along with high quality data about that providers, payers can enable primary care physicians, for example, to steer towards the right care instead of member sometimes deciding on their own, and or maybe not able to get access to care, right? But with high quality primary care physician, for example, high quality provider data, members would not end up in ERs as much as they do today, in when there is a high quality network present for the members. Then if the payers have clarity about the providers, high quality providers, and they have high quality information about those providers, and they have visibility around those provider operations, then there are opportunities for payers to work very closely with those providers, and that can lead to high network retention. Right? That's point number 3. And then, as I mentioned before, the referrals can be much more effective if you have member customized network. And then, for example, member customized primary care physicians can then refer members to the right set of specialists. Okay, so all in all, I think this now is an opportunity to leverage all different kind of data sets, internal as well as external, to create high quality network of providers to solve some of these challenges.
Yeah, and Carl, if you can go into detail in terms of what have you seen with regards, especially in the network steerage and referral analytics space from the provider / EMR side, right? I think ultimately one of the main goal for health plans is to be able to steer members or guide members to the high value providers. But from the provider side, they may, what you've been saying is that there's been a lot of lack of interoperability or sharing of data, and as well as lack of real-time analysis and approach. So how have you seen this actually impact care management and referral management overall?
Well, there's a lot of in your question there that I could address. I think, first of all, going back to Amit's main point, this is an incredible moment for AI in our industry. And most people are familiar with its ability to help us automate things that today are manual. But there's also an opportunity to do entirely new things, whether that's an analytical task to find insights that previously were opaque, or even new value propositions or new functions within the health plan or the provider organization because AI enables it. For example, it's one thing to have a provider directory that tells you the names, specialties, and the addresses, phone numbers of providers. It's vital that that be accurate. But now with AI, a member could actually have a conversation with an AI bot about all of the different providers who might be appropriate for their care, which gives the plan a unique opportunity to guide the member toward a high value plan. Usually when new technologies come around, we first think about how to do the old tasks in a new way that's more efficient, but then people's imaginations kick in and they realize there's entirely new things that can be done with this technology that were never done previously. But the foundation there is high quality data, and that's what HiLabs is focused on, among other things, because if it's garbage in, it's garbage out. We all understand that. And that's why it's an imperative that the data be accurate today. I think to answer your question about the provider side, providers are facing the same challenges. They have demands from patients. They have many different health plans that they are interacting with. And I think everyone's familiar with the fact that today on the revenue cycle management side, we're seeing a little bit of an arms race. And this is a case now where the providers may have actually gotten the jump on the payers when it comes to using AI. Many of the payers I speak with point to the fact that utilization and acuity is up. And a lot of that, they believe, is coming from some of these technologies used in the provider environment to better document the needs of patients and to better justify higher acuity codes. And so payers need to respond in their own way by making sure that their infrastructure, augmented by AI, can address that without people being caught off guard. So in terms of specifically regarding provider networks, I think the issue mainly for providers is that even if as a payer you are 15% of their member volume or 20%, you're still a minority of the volume. And there's a long tail of payers that each provider has to understand and work with. And as a result, providers up until now have not really changed their workflow for a given payer. But with the augment of AI and real-time data and accurate data, that may become a possibility. So you can imagine, for example, an exchange happening in the background where a payer is saying to a provider, we have a patient for you. You know, this would all be automated, right? And then the payer is providing some information about that patient to the provider, and the provider can then respond with like, yes, we're a good place of care for that member because we have certain capabilities. I mean, I'm brainstorming here, and we can all brainstorm. But I think the point is there's new ways for providers and payers to interact, specifically when it comes to managing the network and steering members to the best high quality care that will be augmented by AI and new ideas. But none of that can go anywhere if the data is inaccurate and slow. So step one is to sort of get all that data organized, which is something Amit is talking about.
Yeah, and then if I can add to that, to Carl's point that now with technology there can be enhanced and real-time interaction between payers and providers. And when we talk about creating high quality provider network, the quality part, there are opportunities for creating or having tools and platform that can enable payers to define quality which is customized towards their needs and their business. So when I say their needs and business, based on different payers geography, uh, based on different payers focus in terms of lines of business, and then how they are contracted with each provider, um, there it's hard to believe that there can be a universal provider quality metrics, and for that kind of customized provider quality assessment, there needs to be a platform that can bring in all different kind of data sets with almost no manual effort, because traditionally just to curate data from different sources has been a challenge and requires a lot of manual effort. And with today's technology, which can be using AI, can be agnostic of the formats of data being exchanged, and the technology can bring in all of that data, can help the business users within the payers to come up with their own ways of defining quality, and can be transparent with the providers, and that can lead for lesser provider aberration, because now both parties are very clear in terms of how the provider quality of care is being assessed. And so I think AI can help in rapid ingestion, curation of data for users to define the right parameters and metrics in terms of provider quality.
Great. So just to summarize for everyone online, what we've heard from Carl and what we've heard from Amit is that ultimately there's a lot of disparate data sources that exist, from claims data to EMR data to market data, member data, etc. And traditionally, there are a lot of data silos, data inaccuracies, inconsistencies across the board. And there needs to be a combination of a unified platform as well as AI to really make use of the data to ultimately empower not only the health plan, but also the provider, and on top of that, the payer to provider relationship across the board. So moving into that, what we believe is the path forward is really discussing that the amalgamation of all of this data is how we can truly steer members to high performing providers. And based on what Amit and Carl have said, I think involves a lot of, like, what, for instance, Carl mentioned interoperability, Amit mentioned Amit mentioned being able to take in the custom parameters by a health payer themselves as well. And so we'll be going into the questions from the audience to really discuss what is truly the path forward to this. Where do we see AI truly playing a role across the board? And so one of the questions that we have is, given the proliferation of private equity investment and M&A activity in healthcare have fundamentally changed the way that most patients experience healthcare over the past 10 years, how should steerage evolve in response to the private equity and M&A activity have impacted care delivery outcomes and member experiences? So, Carl, I think it'd be really helpful if you can describe what trends you have seen on the private equity and M&A space and how that has impacted healthcare. And I think, Amit, if you can kind of deep dive into why it is important to have that level of customization on the health payer side in the ever-evolving landscape. That includes M&A activity. So, Carl, you can go first.
Sure, I'm happy to address that. I think we've all seen in the newspaper or in other channels examples where otherwise good providers of care have become owned by a private equity firm that has taken risks with respect to the borrowing and leverage of business that has led to bad outcomes. And I think we're all in the healthcare industry because we believe that we can help people through the work we're doing collectively. And I think whenever there's an example of a private equity firm doing something that undermines trust, we know that that further hampers trust in the entire system. When you ask people about their trust in of the healthcare system, unfortunately, there isn't a high degree of trust for pharma anymore. There used to be. It used to be number one on the list of respected companies. The top few were pharma companies, not anymore. And I think, unfortunately, a lot of people have taken a negative view toward health plans as well. And I think now that we have very dominant providers in certain markets, they also, to some degree, are undermining trust, whether that's because of very high bills, surprise bills, or other reasons. So I think we all have collectively a lot of work to do. My hope would be that what private equity can bring in certain cases is the capital needed for good ideas to expand and grow. I'm a venture capital investor. We typically are put in a better light because venture capitalists are providing capital to companies like HiLabs who have a great set of new ideas and they just want to grow and expand to help their customers to be successful. So in venture capital, you're typically giving that essential money so that business can be built and grow. Private equity, on the other hand, when people think about buyouts, often it's taking a company that's already mature, changing the ownership of that entity, and then making other changes trying to improve the profitability. And this is where, at times, there have been events that really undermine trust. So I can't speak for that whole area except to say I think it does take a collaboration between innovators who are privately backed and institutions that the public has come to trust, including nonprofit health plans and nonprofit providers. Everyone just has to collaborate well and focus on quality and compliance above the bottom line, but then also make sure that what we're doing is financially sustainable. So I'm not sure if that really can cover the participants' question fully, except to say that it does take collaboration between multiple parties to weed out bad actors so that we can get the benefits of capital investment for a better infrastructure and a better healthcare system.
Yeah. And Tiffany, to cover the customization point, now investors, rightly so, are interested in ideas that can scale, right? So solutions that can scale, and we have been talking about a lot of customization, right? That quality, how the quality is being assessed, it might be very customized towards each payer and provider combination. Now, in general, customization means a lot of siloed work for each plan, and how you can, and scalability means build one and utilize multiple times, right? And how both of them can go in hand in hand. So how can you have a philosophy of build once and deploy multiple times versus customize for everyone? So now today, AI, as I mentioned, has the power of putting reason to what they're doing, what it is doing, and then the AI has the power to ignore different type of formats of data, and what that enables is ingesting, curating, taking in inputs from the users about different type of even customization rules. That, like, imagine different payers can just type in their different customization, and there's no human involved, or there's no engineer involved in putting that customization. That can all be done by AI and create a customized solution without any human intervention, right? So today is that time where customizations can also be done at scale with the philosophy of like build once and deploy at multiple places. So that's something that I would say technology can do, and we are actually working on many of those initiatives. One example I will quote is which is based on provider. How do we help in provider improving provider evaluation when it comes to providers submitting, let's say, a ticket to a customer. Now, traditionally, that requires like battalion of consultants or operators reading those tickets, understanding the provider issue, and then taking an action on it. Right? Now, with the help of agentic AI, we are working with a large national payer where we are deploying our technology to understand those tickets how a human would do, can reason how a human would understand that ticket, and can investigate um, uh, by looking at all different systems how to address that issue for a provider, right? So that's just one example of how technology can scale and can reduce provider evaluation, because in that mode you can respond to the provider with appropriate information or can take action much faster than how a human would do.
Great. So to summarize for everyone here, ultimately, we understand that there's a lot of M&A going on in the space across providers, and as well as we understand that there is like a lot of financial implications related to healthcare delivery, outcomes, and member experiences. But at the end of the day, this is just another additional parameter that AI can really take account for when it comes to either taking in custom requests, either from provider to payer, or when it comes to designing the network or related to member steerage. These are all different configurable parameters that AI is able to really account for in general. Now, I want to pause here because ultimately I want to encourage everyone to submit questions via the chat. And while we're doing that, I really want to ask Amit and Carl here, in your eyes, how can AI shift the network manager's role from reactive to strategic, and what does that future ultimately look like? And where does real-time analysis really play in this new approach? So Carl, I'll pass it off to you first, and then I'll go with you second.
Sure, I'm anxious to hear Amit's view because he lives and breathes this type of question every day. But what I've observed is that there is often in healthcare a trade-off between a narrow network that may have high quality and low cost and a broad network. And we know that often members want many choices, but if we want to deliver high quality and low cost, that often comes together by focusing patients on those high quality providers, going to those providers and saying to them, we can give you volume if you give us a price that works for everybody or works for the payer. So I think that's often a trade-off. We've seen different types of health plan emerge, like what are called alternative health plans. Most notably, United has brought to market through Surety a plan that's growing very quickly that is that type of plan. It was originally called Bind. There are others. We're investors in a couple of them. One's called Centivo, one's called Firefly, where the focus is a bit different as an alternative health plan. We're trying to say to members, we're going to give you a price break, but we're going to ask you to go to these higher value providers. It's a common dilemma in healthcare because a lot of people don't like being told what to do or being told that they have fewer choices. So I think what that calls to mind is, and I'm again sort of more shifting to brainstorming mode, is there a way, if you have high quality data and if you have AI deployed, to do this in a bit more of a dynamic fashion? So instead of saying everyone's going to go to these 3 providers, you can be a bit more nuanced about the specific needs of a member. So you're really guiding them. You're providing a steerage service that feels more like a service, a benefit, than a restriction. And I think in general, we need to keep thinking of solutions for health plans to deploy that make them feel to the provider or the member more like someone who's trying to give them good options for their needs. Increasingly, patients are paying a good portion of the cost of care through cost sharing in their health plan. And so I think there is alignment. People don't really want to be wasting money, but sometimes the incentives do get a bit skewed. And so the more we can use AI to provide customized guidance to members and providers, I think the more people will see that as a benefit and a win-win as opposed to a blockage, whether that's pre-authorization, network steerage, revenue cycle management, or some other function.
Carl, completely agree with you. The key here is how do we enable high quality member or network steerage, right? And for that, the step one is how do we monitor utilization by our members, right? How do we monitor without, again, engaging like hundreds of engineers to do this manually? How can technology or in terms of agentic AI can constantly look at member utilization and from those utilization patterns detect opportunities, right? Opportunities to be proactive in terms of, let's say a member is not going to his or her primary care physician and ends up in ER more frequently than a member of a similar profile in similar geography. Right? Then look at, okay, is the primary care physician data is accurate? Maybe the member is not able to access that primary care physician because that PCB doesn't practice at that location. Right? So it all starts with monitoring, then looking at the data quality, around that insight, and then proactively identifying what providers that need to be recruited to fill those gaps. And again, when you do that, it has to be accompanied with high quality data along with the metrics to, or I would say customized metrics towards identifying the high quality provider, right? So going back to the same point that all of this, right, whether it's network steerage, whether it's network design, all that requires at speed, because time is important, right? So it has to be timely. So at speed, how you can monitor these gaps and then take action to fill these gaps by identifying high quality providers by accessing high quality data.
Great. We have another question from the audience. One of the questions is, often payers and providers are eager to implement new applications to reduce cost, but they may not have the right data to support those initiatives. How do you address that challenge, and how should it be factored into the overall cost analysis? So, Carl, I think one thing that we can talk about here is, what does it look like on both the payer and the provider side that you've seen in terms of what data you have access to? And I think, Amit, it'll be really good for you to talk about from the payer side, all of the data. It's not just about data access, it's also about holistically ingesting all different data sources in a unified platform and data quality, what that ultimately means. So, Carl, can you go
Sure,
first?
and I know we only have so much time, so I'll try to be brief. I'll say that again, just like I mentioned how providers have deployed AI to get an advantage currently when it comes to the revenue cycle by deploying AI to code in a way that optimizes revenue for the provider. I think providers also are being quite innovative when it comes to data. Because of health information exchanges, increasingly there are technology and services providers that are allowing the providers of care to get more of a 360 view on the patient that goes beyond the four walls of the institution where that provider has practice. So these HIEs have been deployed for some time. A lot of the major electronic health records participate in them. And there are companies that have come along to say, we can aggregate patient data, normalize it, make sure it's accurate, and then feed it into your workflow. So providers have access to this data because they're treating the patient, and under the treatment use exception in HIPAA, they are allowed to see the 360. Payers are somewhat more limited. Payers have richer data about their own members, but often they're flying blind when it comes to certain types of data. So I think it comes down to finding partners like HiLabs who are laser focused on your specific business objectives and can work with you. What I observed in HiLabs is everything they do is designed to create a scalable platform along the lines of what Amit described earlier. But they also recognize that they're in the real world of healthcare, where the specific needs of a given payer may be quite unique. And so being able to combine a platform approach with a real sort of customer intimacy so that you know that the solution you're delivering meets the payer's needs, I think that's kind of, it's easy to say, it's hard to do. And I think that's what drew me to HiLabs, was their ability to talk the talk, but also walk the walk in that regard, so that people can, when faced with the challenges that Sam is pointing out, they know what they want to do, but they don't have the data to do it. I think often it helps to work with a partner who shares that focus.
Yeah. Thanks, Carl. I'll give an example of how technology can help the whole payer-provider data exchange. So providers send a lot of rosters to payers, and rosters in a specific use case is all about sharing provider, some of the demographic information of the provider, about like something like where the providers, what the providers' locations are, what specialty, and things like that. Now, each provider, right, it is expected for provider, right, many times it is expected for providers to send data to payers in the payer specific format. Now imagine providers are already stressed thin. Now they also have to now send data in a specific format to all different payers, right? I think, or we come up with a traditional approach of coming up with a universal template to share data, right? Which means, again, many years of changes in the provider systems, payer systems, and I think that was probably in early 2000s, right? With the AI coming in, we should just ask providers to send the data in whatever format that they want, right? There should not be any need of these universal templates, right? AI should be able to read the data, ingest the data how humans would do, and then AI has the capability to scale, right? That humans can't, right? So that's one of the problems that we have solved with several payers, where we are taking in all these rosters in any type of format, and we are able to bring all those different type of formats into the payer specific format using artificial intelligence. And we are also able to augment that data with payer specific customized rules around the payer's networks, the payer pricing information, so that end to end we achieve automation. And that leads to what we have seen, something that was getting processed because of manual, through manual operations, that was getting processed at the rate of 4 to 6 weeks, we have brought down to in few hours, right? So I think I would say with technology, the vendors have to start thinking about coming up with those kind of solutions so that it can reduce burden, especially on the providers.
Great. And ultimately, another question that is brought in is more so, how do we see, like, what does network steerage mean in this context of this world of data quality, artificial intelligence across the board? Where do we, what is the actual true benefit for the members beyond just cost savings? So Amit and Carlo, if you guys can go ahead, we'll change it up and have Amit lead first.
Sure. Imagine a member has been treated by, let's say, Dr. Tiffany Khan, right? Tiffany, let's take an example, right? Let's say Amit Garg being patient, always being treated by Dr. Tiffany, and Dr. Tiffany, let's say for some reason, goes out of network with Amit's insurance plan, right? And if Amit is in a dire need of getting treated, he is going to end up going to Tiffany for his treatment, and that will end up in out of network bills for the patient, right? And the reason is if the patient does not have access to alternatives, right? Because of not having access to accurate information, there will be more and more incidences like this. Or if um, even in worst case scenario where the patient cannot afford those out-of-pocket expenses, might delay the care and might end up in an ER, right? Which is a burden for everyone. Right? So I think high quality data is a very, very strong foundation for any impactful use case or any impactful initiatives that plans and providers have in their operations.
That was well said. The only thing I'll add to that, and I'm saying this from the perspective of a venture investor, where we often see new solutions for specific member problems like chronic conditions, where they're currently maybe not well served by the healthcare system, and they do end up in the ER frequently, and that just drives up costs for everybody. I think it's important for health plans to have in mind the many targeted solutions that now exist that are more virtual first, such as in the digestive area. We're not investors in the company, but there's a company called Oshi, which helps people who have digestive issues. And it turns out that a combination of mental health and GI type support is what's needed to keep people on track and out of the ER. Similarly, we're investors in a company that focuses on people who suffer from obsessive compulsive disorder. We have one that focuses on eating disorders. As a payer, sometimes we're processing things sort of claim by claim, event by event. But if you step back and look at the data comprehensively, you see, I have certain members with these chronic conditions. And if I can be more proactive and handle that better with a certain type of care, it might prevent a lot of cost downstream. So I think with respect to the notion of guiding people, someone may come in saying, help me find a GI doc. But if a payer is partnered with a company like the provider I just mentioned, they might be able to guide that member in a very customized way toward a solution that's part of that payer's existing digital formulary, if you will, digital ecosystem, so that they can then save cost and give the member greater value.
Great. And we have one last question. Have you, with the provider roster updates specifically, one last question here. If the way we are steering is evolving so quickly, how do we evolve and demonstrate the value of the steerage to employers purchasing network solutions for their members? So for example, how do we evolve in the environment of M&A, or how do we evolve in the environment of regulatory and compliance? How do we evolve in which, for example, we see large national health plans acquiring smaller health plans, or provider sponsored plans also trying to enter the space as well? So how do payers really accommodate for all of this? So we'll start with Amit here.
Yeah, I mean, Tiffany, I believe you are more qualified to answer that question than me. So as a product owner of Network IQ, so I would like to give this opportunity to you first.
Yeah, it's a great question. So ultimately, when it comes to network management or network development, we have to think about what we call the 3 C's of network management: compliance, competitiveness, and cost of care. And ultimately, traditionally, payers have been thinking about this very much in silos of we think about network adequacy, then we eventually think about how do I, as say, a United Healthcare compare against an Elevance, compare against a Humana, Aetna, Cigna, etc. And then last but not least, we think about to optimize the network itself for the member, for the business, for the provider, etc. And in reality, what the actual need here is to really have an accuracy of first approach that accommodates for all of these different parameters, to be able to curate the highest performing, cost effective network for the payers members itself, stay ahead of their competitors, and as well as forecast any network disruption as providers enter and exit their networks. And the only technology that's able to do that is artificial intelligence, AI, to be able to handle all of these different types of either data movement, data inaccuracies, as well as different parameters that users need to leverage. For example, if I am someone who's a network contract manager, I am obviously going to try to advocate to contract with, say, Johns Hopkins University, but someone on the healthcare reimbursement or the health economic side may disagree. And so a solution has to be flexible to be able to accommodate that, but also ingest all the different data sources as well.
I mean, just to summarize, I would say payers have started and should be thinking beyond just meeting those network adequacy rules, right? I think traditionally network management was the focus was lost a lot on just meeting those network adequacy rules. I think we have to start focusing on the true supply of providers along with their quality metrics, which is customized for the payers member cohorts. I think that should be the approach, rather than just thinking about the adequacy rules.
All right. So I want to wrap up, given the time, I do want to wrap up this webinar itself. I want to really summarize the overall discussion we've had today, and that ultimately, in order to curate the highest performing network, to steer members to high performing providers, it ultimately comes down to three things: timely data, accurate data, and as well as complete data, all in a singular solution itself. And that can only be accomplished with artificial intelligence, as well as vendors like HiLabs that are really subject matter experts in the provider data, clinical data, claims data, and member data space. And so I'll pass it off to AHIP, specifically Joanne, to really close off this webinar itself.
Great, thank you. And to our speakers, thank you for that great presentation and for sharing your thoughts. Thank you to the audience for participating in today's webinar. This concludes today's presentation. Thank you again and enjoy the rest of your day.